Hi, my name is Paul Haslam. I'm a consultant orthopaedic knee specialist working here at the Coriel clinic. I've been a consultant now for nearly 18 years, and during that time I've seen all manner of patients with knee conditions. I'd like to talk today about knee joint problems, and I'm going to use a crunchy bar theory to help us explain what I mean. To start with, we'll have a look at the knee model and go over a little bit of knee anatomy. People often don't understand the difference between the cartilages in the knee, and there are two types of cartilage and they're completely different structures. There's a thick fibrocartilage meniscus which lies between the two bone surfaces, and then there is the joint bearing surface, which we also call the chondral surface, which is made of hyaline cartilage, and these two structures are completely different. The meniscus is often torn when you twist your knee, and we see many patients, sporting or otherwise, who have injuries to the meniscus. Chondral damage can occur in traumatic episodes, but also occurs as patients get older with osteoarthritis. And when that joint bearing surface is damaged, that's what arthritis is. Looking at the crunchy bar, this is quite similar to how a knee joint looks like. The chocolate layer represents what we call the articular cartilage, the chondral surface made of hyaline cartilage, a specialised low friction surface. Underneath that there's a hard layer, we call that the subchondral bone, and the honeycomb of bone underneath that. This is particularly relevant when we see a condition called subchondral insufficiency fracture. These patients present with increasing pain suddenly, spontaneously out of the blue. They may have had a little bit of knee pain prior to that, and they may have known to have some arthritis, and the symptoms rapidly fall off a cliff. And it's a bit like you push your thumb into the crunchy bar and the whole thing collapses a little bit. And this is how it looks on the MRI scan. So we see here, this is the normal side and this is the abnormal side. There's increased activity here, and you see there's a little line here which indicates a subchondral fracture. The symptoms will settle after 3 to 6 months after this injury, but often patients do go on to surgery in the form of either a partial or total knee replacement. If you have a problem such as this, it's well worth getting it checked out. Increasing pain dramatically like this may require crutches or a brace and further treatment. I hope you found the crunchy bar theory enables you to understand better the knee joint and different types of cartilage in the knee. And if you do have increasing pain, then it'd be worthwhile contacting us here at the Coriel clinic.